So today at the ESC in Barcelona, I presented the results of the Marfan Treatment Trialists Collaboration meta-analysis of randomized controlled trials of angiotensin receptor blockers. The key message of our study is that there are now two treatments for patients with Marfan syndrome, which is a rare genetic heart disease that causes enlargement of the main blood vessel coming out of the heart, or aneurysm of the aorta. There had been 7 trials that were eligible and available for us to analyze, and we put together these trials into a meta-analysis which allowed us to answer additional questions that could not be addressed by the individual trials themselves because they were not individually large enough to address all of the unaddressed questions which clinicians and patients had about these medications. What we found is that both angiotensin receptor blockers and beta blockers were both effective in slowing the rate of enlargement of the aorta, with each medication reducing the rate of enlargement of the aorta by about half. We found that angiotensin receptor blockers were particularly effective in patients who had mutations in the FBN1 gene that causes Marfan syndrome, and we found that the effect of angiotensin receptor blockers were not dependent upon the effects of beta blockers, and so these effects seem to be independent. We were also able to use an indirect method of analysis to assess the effects of beta blockers, and we found that the effects of beta blockers were similar in magnitude to those of angiotensin receptor blockers. So we're really excited about these results. We think they provide evidence for the effects of 2 different medications in Marfan syndrome, and we think it's highly reliable, and we think that the message for clinicians is that they could consider thinking about these medications for their patients, either alone or perhaps in combination, and if they do that, that they're likely to delay the need for surgery and perhaps aortic dissection in these patients.